Hey everyone, my name is Nabil, and I'm going to be talking to you about long-term services and supports. The first question, when I think about the main goals of long-term care, I think it really comes down to helping people maintain the best quality of life possible. Long-term care is meant for people who may not be able to fully care for themselves because of aging, disabilities, or chronic conditions that they might have. So the goal just isn't medical treatment. It's also helping with everyday activities and like getting dressed, moving around, managing medications, etc. Whatever. Another important goal is helping people stay independent. Right? You don't want them to be completely dependent on someone else. You want them to kind of feel like they're working for themselves and actually getting things done and aren't just reliant on everybody around them. A lot of time people prefer to receive care at home or in a comfortable environment, so that kind of helps their morale and their self-esteem. And overall, long-term care should be focused on dignity, safety, and making sure people feel supported. When I looked at the demographic information in the chapter 8 of the book, the things that stood out to me most was how fast the older adult population is growing. There's more people that live longer than ever before, of course, because of medical advancements and vaccinations, etc., especially those over 65, which really caught my attention because many people are living longer, but their bodies are deteriorating, and they're aging in every part of their life, mentally, physically, everything. So to help with that, long-term care also includes managing those chronic conditions and daily activities. I also noticed the population is a lot more diverse in today's society, which means long-term care services need to be more culturally aware of what's happening and what they're dealing with, and to adapt to it. To me, this really shows how the demand for long-term care is going to keep increasing over the next coming years and probably forever. Because of that reason, healthcare managers are going to have to think ahead and plan for the future to find a way to handle these challenges while focusing on the main goals of long-term care. One way to do this is to expand home and community-based services, since many people prefer those services and can also reduce costs for the department itself. Another important thing to make sure is enough training is given to find these caregivers, because staffing shortage is already a big issue. So you don't want to just accept anyone and everyone. You want to make sure you have good quality individuals doing the job. And healthcare managers might also want to focus on training the staff to work with people from different backgrounds, like cultural diversity I mentioned before. Technology could also help, like using telehealth, which is becoming more prominent in a healthcare facility for sure, and better coordination systems to support patient and caregivers. But at the end of the day, it's important to keep things like the patient at the center of the care. As demands increase, you want to focus on each patient. You don't just want to go from patient to patient to patient and just not give great quality care to them. And overall, long-term care is going to become an even more important as the population continues to age. If healthcare leaders can plan accordingly to that and the diversity that they're going to be experiencing with those patients, then great. That's what needs to happen. And these services will continue to improve and expand over time.